Hi, Assalamu alaikum. My name is Dr. Muhammad Zafar Iqbal. I'm a postdoctoral fellow at McGill University, Canada. And today I would like to talk about evidence-based teaching, which is a critical gap in medical education. We all use different teaching strategies on daily basis. For example, we are involved with lectures, problem-based learning, team-based learning, case-based discussions, bedside teaching, simulation-based teaching. uh, this begs the question that how do we actually learn to teach? As you know, most of the specialties, clinical specialties, they do not teach you how to teach during the training. And once you're done with the fellowships or the masters, then you join a teaching field. So where did we actually learn to teach? So there's no specialized training on how to teach before we take up this challenging role. So then there are some common learning approaches that people use to improve their teaching practices. For example, they use the most common method, which is see one, do one, and teach one, or the trial and error method, or they use the continuous professional development activities to polish their knowledge, skills, and attitudes, and to perform their different academic roles. This brings me to what do we actually mean by evidence-based teaching? Evidence-based teaching refers to the pedagogical tools and techniques that have shown through rigorous experimentation to promote learning. Another definition of evidence-based teaching is that the process by which individuals involved in teaching use research findings to inform their teaching practices. So there are different kind of evidence available in medical education. For example, there are meta-analysis of experimental or controlled trials. This is in the sense of medical education. It is in the form of systematic reviews available in the form of BME guides or EME guides of medical teacher. And in clinical sciences, an excellent example is Cochrane review. And then there are randomized control trials, quasi-experimental studies, non-experimental studies, and there are descriptive studies. So and then there are expert opinions or perspective papers. As you can see, that the rigor and the quality goes down as we go down the ladder, which means that the reliability as an evidence also decreases, yet they remain a source of evidence. Uh, a very common question that I'm often asked is that what is the difference between evidence-based teaching and evidence-based medicine or evidence-based practice? I would like to highlight few challenges. First of all, evidence-based teaching is very context specific. The context specificity of the educational research makes it very vast and dynamic field. As you know that, I'll give you a very layman example. If you use beta blocker for hypertension, it is going to react the same in a controlled environment on every human being. But uh, our minds are not like our physiological bodies. Our minds are very unique, very dynamic, and they differ from each other a lot. We think different, we perceive different, we store information in a different way. Our cognitive schemas and processes are different. So these things make us unique individuals. Secondly, there's a difference in the educational context as well. For example, there's a different education system in place in the Western countries as compared to Asian or Middle Eastern countries. So a problem-based learning has been a very successful approach in Canada and in Netherlands because the students over there are involved in problem-based learning and critical thinking and problem-solving techniques since they are in schools. But us, at least true for me in the Asian countries, we are not involved in such kind of activities, and our system is geared towards promoting rote learning, which is why it might not be possible to successfully implement PBL system directly into an Asian or a Middle Eastern context unless and until our students are ready for that. And then there's a quality and strength of available evidence. Please note that medical education is a very novel field. It is hardly 15, 20, or 30 years ago, 30 years old, and the literature is still underdeveloped. Whereas in medicine, there has been a decade of research on different aspects. So, and since it's a novel field, we are still trying to develop different rigorous methodologies that can be used to have a fruitful research. Then there's a less control on confounding variables, because obviously we are humans, we think different from each other, and we have a lot of perspectives that cannot be confined to simple dichotomous answers. And then there are relevance of educational research in the real world. You might have heard this very frequently from your colleagues that, see, there's a lot of good findings in the literature, but they're very ideal and they are not very much realistic or practical. The problem here is, first of all, it might be the wrong perception of the teacher who perceives the information to be ideal and not practical, or in reality, the paper might not be a good paper, or the study might not be a rigorous one, and it is published in a low quality journal that did not ensure good quality standards, but yet, unfortunately, it became a piece of evidence. So yes, this is a challenge. And then there is an unclear definition of the term evidence in HPE. Some people think that only reading the literature and applying it to their teaching practices is evidence-based teaching, whereas it's not the case. I'll explain to you how. There are some critical barriers to evidence-based teaching as well, at the individual level and at the contextual or organizational level. For example, lack of knowledge about evidence, lack of skills to search evidence, lack of confidence in search abilities, poor attitudes and misconceptions, like I explained before, and preferences of experience over evidence. As you know, many teachers prefer their old practices instead of moving on to the novice ones. And lack of resources, lack of institutional support, and the workload and time constraints, and finally other priorities. These are different challenges that we face at the organization level that stop us or inhibit us from performing evidence-based teaching. As a consequence, there's a limited evidence utilization in teaching actually that leads to variable impact on learning, and the gap between research and practice keeps on increasing. And there's always an increased experimentation because we do not know how to effectively teach. And we keep on experimenting using hit and trial methods unless some method suits to our needs and demands. The challenge here is the critical appraisal and the scientific scrutiny, or should I go for personal experiences, beliefs, values, and dogmas? Well, like I said, I'll explain later. Here, I'm going to tell you, this picture is taken from BME Guide number 1. Evidence-based teaching is a judicial balance between personal experiences and evidence. So opinion-based teaching and evidence-based teaching. Every situation is not going to fit in your context 100%, but that does not give us the right to reject evidence. So I have carved some practical tips from the evidence that can help you do the evidence-based teaching. For example, you should clarify what exactly you want the students to learn. Is it knowledge? Is it skills? Is it attitudes? Align your teaching with the curricular objectives and the competencies and the intended assessment. If you want to assess psychomotor skill of the student at the end of the course or the year or the curriculum, then your teaching should be aligned with that. For example, if your objective is observing a student performing, applying suture, so you cannot teach that in a lecture. You must teach that in a clinical workplace, or in an OT, or in a minor surgery where you apply, or in a simulation lab where you actually you do that in front of him or her and let them replicate the same performance. And then use multiple means to align teaching with your knowledge, skills, and attitudes. Use questions to assess your prior knowledge and level of understanding. This will help you to keep your students in the zone of their proximal development, which means that you will be able to do an incremental increase in their information instead of bombarding them with information that will not be retained for a longer period of time. Then use multiple teaching aids. Don't rely on one approach. Give opportunities to practice. Practice makes perfect. Then give constructive feedback. There's a lot of evidence that suggests that feedback improves learning. So always try to evaluate what is the status of your students learning and how you can improve. You can help them improve it by giving a constructive feedback. Promote peer-assisted learning. There's sufficient evidence that suggests that students who learn with their peers or in groups, they have better outcomes and they become better team players and better medical specialists or practitioners as compared to those who work in silos. And then to promote a culture of self-regulated and lifelong learning among the students, that they are not dependent upon you only, that they can drive their own learning, they can set their own educational goals, and they can become a lifelong learners. I have some take home messages for you for the day. For example, I would like to say that evidence based teaching is a judicial use of the literature evidence coupled with personal experiences. Please, you may not have to solely rely upon the literature only, but do not ignore the power of evidence. Avoid trial and error methods. Please try to say no when you are given the responsibilities that you are not ready to take. So it's a part of your own self accountability. Develop skills to explore the literature and see what works best for you in your own educational context. Uh, Always continuously work on your professional development, as learning never stops. Thank you very much for listening. Jazakallah khair. Bye.